Hi, everybody, and welcome back to Senior and Living Today. I'm Courtney, and today we're going to talk about something that I believe is very important, and that's the medications that we're on, prescriptions that we need, or accidents that may happen that are going to require you to seek medical attention. The reason why I think this is important is because it's been listed over 238 medications that there's a shortage of right now. Some, there's just a shortage and they're watching how they're administered instead of things that are administered always when you go to the hospital or you ride in an ambulance are now, I don't want to say optional, they're selective about when they give them. This is at doctor's offices, this is in ambulances, this is when you're in the hospital, this is when you're in urgent care. So we need to, at this time, be very careful of not to injure ourselves, not to become sick, not to need treatment because supplies you may need may not be available for you. Like I said, there's over 238 that were listed on the website, and I will link it below. And several of them are very common ones that you would know. There are some names I didn't know or recognize automatically what they're used for. You might, but there were definitely some that we hear about every day. Either we take them personally, or if you watch TV, um, they're medications that you have heard over and over and over again. And it is not just medications, it's also um, supplies. So, gloves and butterfly needles and tubing for blood draws, those kinds of things. So, those aren't medications, but they're needed in the medical field. And if you go to the hospital or go to the doctor, they're going to want to draw something, get a sample of something, and all these things come up. So I want you to be really careful about those. And, if you need any medication, check with your pharmacy before you run out, check with your doctor before you run out. They may have to find a substitution for you. They may have you alter how you take a drug. It's gotten pretty serious out there. So pay attention. And if you have loved ones in your family that take medication, you want to be super aware of their medications as well. I know for me, I take a medication that's on the list. Um, I do have a supply right now, a 90-day supply, but sometimes your primary care or your provider won't give you a 90-day supply. And if it's a medication that you need because of a recent injury, you wouldn't know, you wouldn't have a 90-day supply until you go to the emergency room or the hospital. So be super careful out there. I'm going to read to you some of the things that are on the list. You can see if they're familiar to you, and you can see by some of these drugs and what they do how serious this could be. Actually, how serious this already is. So, some of the things on the list are lidocaine. I think a lot of us are familiar with that and have used that at some time. Sodium chloride, syringes are short, dextrose, a butyrol inhaler. I've used that in the past. A lot of people with asthma and breathing disorders um, need albuterol, and there's a shortage of that. Um, Aspirin suppositories, diazepam, which is Valium. How many people have used that either to um, get into an MRI scanner or a CAT scanner? They need a Valium to, because they're claustrophobic. That's important. Epinephrine. I've heard that that's a very common drug. Dopamine, fentanyl, hydralazine is a popular one. Heparin, they use heparin all day, every day in medical facilities. Ketamine, hydrochlorothiazide, which is a blood pressure medication, and that's one I take myself, and there's a shortage of those. Losartan, lorazepam, lithium. Lots of people take lithium. Lisinopril, which is also a blood pressure medication. Multiple vitamins for infusion are on the list. Morphine injections are on the list. If you've ever had a kidney stone and you go to the hospital, the first thing they do is give you some morphine. They're low on morphine. Nitroglycerin sublingual powder, prednisone oral tablets, potassium chloride injections, phenobarbital injections, sodium bicarbonate injections, sterile water for injections, and tramadol tablets are tops on the list. And the tramadol is for pain that is often administered in the emergency room. So it's a wide list of things that they're running short of. So we need to be super careful that we don't need them. If you're healthy, stay healthy. Don't injure yourself. Don't get into an accident. Um, if you need to work on yourself physically, like I do, work on it because you don't want to have to be dependent on medication. With the supply chain being what it is, and the United States not making the majority of the drugs that we use, we have to be super mindful of needing those drugs and how it might be very difficult to get them. Um, I've heard them talking about difficulties with insulin. People need that every day. So if you have loved ones that don't live with you, check with them, make sure they're staying on top of any medications that they regularly take. And there's shortage for over-the-counter items as well. So make sure if you need cold medicine, headache medicine, migraine medicine, band-aids, all those kinds of things, get them. I don't know if you remember, a couple years ago when the whole pandemic started, you couldn't find a thermometer anywhere because they had all been purchased. Well, if you're going to need cold medicine, winter comes right after summer. If you're going to need cold medicine, upset stomach medication, medicine for poison ivy, poison oak, anything you may encounter this summer, wasp stings, bee stings, go and get those things now while they're on the shelf because what we have is limited. And when we're getting more, is undetermined. So have it in your arsenal. Go and get it. Put it away because when you really need it, you don't want to be driving around trying to look for it. So get your over the counter items. Be mindful of your prescription items and be safe and check with everyone around you and make sure they have everything that they need as well. I hope that this has been helpful. I hope it's opened your eyes. If you know of any shortages for medication that I didn't mention, go ahead and put them in the comments below for people who are reading the comments, and it will make them aware. Thank you for watching, and I hope you'll come back for more of Senior and Living Today.